Yay. Okay, I waited for someone to get on. Hi, good evening. Dr. Mary with the Remedy Room, an innovative wellness clinic helping you stay out of the doctor's office. And today I want to give another tip on how to stay safe, reduce infection rates, and reduce your risk of heart attack, stroke, diabetes with something that's really simple that you're already doing every day, but we're going to kick it up a notch. And that is taking care of the mouth. The root of all disease begins in the mouth. So Hippocrates wasn't just talking about what we eat, but whether or not we take care of the bacteria that are flourishing in our mouths. So most of us, hopefully, are brushing our teeth every night. And when all this, I call it like the CV storm. We have another storm coming up. But when all this storm happened, we talked about changing the head of your toothbrush, making sure that we reduce the bacterial load. And I want to just bring up a few things that can help to take 5 minutes more in your day and reduce your risk of all those things: infection rate and cardiovascular risk and diabetes. So one, I think an electric toothbrush is a great idea. One reason is you're going to brush your teeth way longer than a minute. And look, the light turns red if I'm pushing too hard, which I have a tendency to do. And that's what is helping these gums recede. Next is finding a mouthwash that's not toxic. So see the cap? Not open. Toxic. This mouthwash, just one example. It doesn't have to be this brand, but it is hypochlorous and basically saline. So non-toxic, doesn't have propylene, ethylene glycol, which is, I think, the stuff that they use to wipe down the plane wings when it gets cold. Non-toxic toothpaste. So doTERRA is one we use. Tom's, that has no fluoride, because we know that fluoride is toxic and that is getting sublingually under the tongue and in the gum. And then look at this, Waterpik. I love it because it takes a little practice to get used to not messing up the entire bathroom, but Waterpik's gonna get a ton of food out that you might have left in there. And of course, after brushing, number one is flossing. So not just putting the floss in between the teeth, but making like a C and hooking up into the gum, okay? The last thing that I think is a really great advance that's probably gonna be less than $2 is a tongue scraper. So there's differences in opinion with doctors on whether or not this tongue scraper, I'm gonna start from the back, whether it reduces bad breath. I would say, personally, I've experienced it, and certainly with many, it's very helpful because you're taking off that top layer of extra bacteria. A lot of us have yeast overgrowth because of the sugar that we eat. And so an excellent way to help reduce bacteria that could potentially get into your bloodstream through leaky gut, which most of us have. And it's those lipopolysaccharides, or the little pieces of the bacteria that are then causing the damage and helping to contribute to heart disease and certainly to autoimmune conditions. So a tongue scraper. Now there's some differing opinions on whether or not it increases or decreases something called nitric oxide. We'll talk about that another time, but basically nitric oxide comes from arginine and citrulline. These are amino acids, and it's a major vasodilator. So we use it in medicine. You can get it from beetroot powder, from things over the counter. There are supplements that you can take sublingually that you can swallow, but arginine and citrulline are the amino acids, and those come from green leafies, and then citrulline comes from watermelon. So those are some easy ways. So the root of all disease begins in the mouth. There's so much more that you can do than just sit home and wear a mask, or you can always wash your hands, but don't forget about your teeth. Okay, thanks for watching theremedyroom.com, and my name is Dr. Mary. If you have any questions, post them for me. And I'm not here to sell a product, and I'm not here to diagnose you. I'm just here to try to help you stay out of the doctor's office because you have so much more power than they let you know. Thanks, guys. Have a great night.